I'm ready. Good afternoon. Welcome to day 287, Christmas Day here at the St. Clair County EMA office, where we bring you what numbers we have today. I'm joined with Chairman Mark Kern. Merry Christmas, Chairman.
Merry Christmas.
And
Herb.
Brian Whitaker here today. Brian, you have some limited numbers today.
Yeah, due to the holiday, the numbers are limited today. No changes in the St. Clair County totals. Those will be reported in tomorrow's update. For the state totals, they have tested 12,881,938. Positive test results is 930,949, which is an increase of 5,742. Deaths, they are reporting 156 new deaths in the last 24 hours, bringing the state total to 15,799. And our thoughts and prayers go out to all of those families. For hospitalization numbers, those in St. Clair County hospitals, we have 101 COVID-related patients, of which 11 of them are on ventilators. And in the region, we have 189 COVID-related patients, of which 15 of them are on ventilators. There are no changes to our congregate living facilities today. And just a reminder, as far as testing, the St. Clair Square site reopens tomorrow, along with testing tomorrow 8 to 4 at the Belle Claire Fairgrounds here in Belleville. Chairman, I'll turn it over to you.
Great. Thank you, Brian. And we would like to wish you a Merry Christmas. Special Christmas greetings to all our friends serving in the armed forces today. And let's especially remember those who are serving overseas and abroad. They're always there fighting for us, and we need to remember them at Christmas. Also, all of our frontline workers, those in the medical fields, in the emergency services line of work, they're working today. They're even though it's Christmas and it's a holiday, many are taking care of COVID patients. They're giving up their time with their families to keep us safe. So let's remember all those people today. They make our lives much easier, and we should be very grateful for that. So we'll move into the numbers today. We have state numbers, which is the zip code report, and then the regional positivity numbers. So we'll move into the zip codes. In 62201, we go up 1 to 446. 62204, we go up 3 to 315. 62205, up 3 to 497. 62206, up 1 to 966. 62207, up 3 to 442. 62208, up 13 to 1135. 62220, up 8 to 1373. 62221, up 19 to 1901. 62223, up 10 to 1200. 62226, up 13 to 2168. 62232, up 3 to 650. 62239, up 6 to 306. 62240, up 2 to 101. 62243, up 1 to 469. 62254, up 1 to 599. 62257, up 3 to 223. 62258, up 4 to 727. 62260, up 2 to 497. 62264, up 3 to 234. 62269, up 29 today to 2,138. And 62285, up 3 to 399. Our regional positivity today, according to the state, is up to 11.7%, not going in the right direction. Bond County came in at 4.6% today. Clinton, 6.4%. Madison, 7%. Monroe, 16.3%. Randolph, 10.8%. St. Clair at 9%. And Washington County at a 15.5% positivity rate. Well, Herb,
Numbers limited today, but again, we wanted to come to Team St. Clair and share their Christmas Day with them. It has been 287 days, as everyone knows, of numbers. And as we said yesterday, we have control of our own destiny there, and we just hope that as everybody goes on with the rest of the Christmas Day today, that you continue to practice what we've been talking about for 287 days. Wear the mask, wash your hands, and if you have to get together, please practice that social distancing. You know, little good news, our hospitalizations are down. We're down 11 in the county, and up 2 on ventilators, and in regional we're down 5, the same 15 on ventilators. So a little decline in the hospitalizations.
But we're not through the woods yet. I talked to a family member today in Los Angeles. They're rationing toilet paper again. So the world, we're not through this tunnel yet. We see light at the end, and the vaccine certainly gives us a lot of hope, and we know it's coming soon. But these shortages continue, and people are continuing to get sick. As you said, 101 in the hospital today on Christmas with COVID, 11 of those on ventilators, and that's just in St. Clair County. It is here, it is spread in the community, and we've got to make sure that spread slows and eventually stops. It's only going to stop because of the vaccine, but it certainly can be slowed by us.
By our actions, yes.
Our fates are in our own hands, and really, it's not difficult to wear that mask. It's just not.
No, well, and I think we got to remember there's 306 of our county residents who lost their life to this COVID that aren't with their families today. And our thoughts go out to those family members that lost that loved one due to this invisible enemy, as we've called it, for 287 days. I know it's rough on everybody. And as we were talking before we came on the air today, we've actually had people that were very skeptical over the past 287 days that were not believing that it was anything more than the flu or the cold. And I want to just thank those people that have called or texted, and they learned the lesson the hard way, either through a family member or through a loved one that contracted this virus. We've been telling you for 287 days, it's real, it's here. 306 of our county residents that lost their lives, and across the state of Illinois, 15,799 lives have been lost to this. And, I'm sure if you check across our country, it's that number is astronomical. And if we don't slow the spread of it, those numbers will only increase. But right here in our region, we have to continue to do our job. We have to practice those 3 W's, and because that vaccines, even though we're getting some of it here in the county, it's still a chore to get everybody vaccinated. And then there's a percentage of those people, Chairman, that don't want to get it. They're skeptical. So the more that gets it, the better off I think we're all going to be. And I've had people call the office here and want advice. Well, should we take it? And of course we say, well, check with your healthcare provider.
We are.
Yes,
when
we'll
it
take
becomes
yes.
available, I'm going to take it. When you see the doctors, the medical staffs at Memorial and St. Elizabeth's Hospital going public, Dr. Bodeman getting that vaccine, that means a lot. Dr. Fauci got his vaccinations. This has all been tested, and they believe that this vaccine is safe, and that's good enough for me. That because I know what the alternative is. The alternative isn't good, and we know that when people get COVID-19, they're very sick, and what we also know is that there can be long-term effects. Even if immediately they recover, they still don't know what effects there are for people who've contracted COVID-19. So let's just stay out of that realm. Continue to do what we're doing. Isolate when you can. Wash your hands. Watch your social distance. Wear a mask, and we'll be through this by early summer. By all predictions, I think that we'll be well on the way to getting back to normal, and then we can go back and take a look at this, and people can judge for themselves with a rearview mirror as opposed to trying to look ahead in that tunnel.
Well, I know you mentioned it earlier about our first responders, and we just want to give another shout out to them because I think a lot of times we take it for granted with what we've been doing for the last 287 days. Those our telecommunicators, the 911 centers, the EMS, the fire, the law enforcement, and all of those essential workers a lot of times get overlooked. They're out there working today on a holiday away from their families, and I just can't thank them enough. When I showed up out at St. Elizabeth's Hospital the other day when they was doing the vaccinations out there, when I saw some of our law enforcement and our firefighters out there, not only have they been out there on the front line, they're stepping up and getting the vaccination themselves. So I think that's another step in the right direction that, we get them all taken care of because we have to rely on them. And we say it all the time. People just aren't getting sick from the COVID. They're having auto accidents, they're having strokes, they're having heart attacks, all kinds of medical issues. Our hospitals, and that's why we're glad to see the decrease in the COVID patients today, maybe freeing up some of those beds and freeing up some of that staff to maybe take a break. But, we don't want to have a surge, and that's what we've been talking about. So we got to get through today, and then we got to get through the New Year's and get into next year, and hopefully we do what we did through Thanksgiving. We get past that without any surge in these numbers. And as we said yesterday, we have the control of that by just being smart. Is the best way to say it. We know what it is. There's no secrets. There's nothing different out there. We know that if we don't stay away from those large crowds, and if we don't wear the mask, and if we don't wash our hands, then we are contributing to that problem. And we need to all be a part of the solution, and we do that by following those 3 W's. And then we'll do that, and we'll get through this. We'll be back tomorrow for day 288 with the numbers from the county today, numbers, and tomorrow. So maybe a little increase tomorrow, but that's to be expected when we didn't have them today. So everybody have a good rest of the Christmas holiday. Be wise, be safe, and we'll see you tomorrow afternoon. Good night.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.